Kia ora everyone. Today we're going to look at this globe with glaucoma. Initial inspection of the globe shows that it is a non-tumor globe. Some of the things that we can immediately see at low power are that there is cupping and that the angles appear to be closed. The lens is pushed forward and this iris leaf is touching the lens. The irises are very flat. These low power features suggest the diagnosis is glaucoma. Looking at this angle, you can see that there is quite a wide adhesion between the iris and the posterior cornea. Here is the trabecular meshwork. This is possibly the canal of Schlemm, and this is the ciliary body. Notice how the iris is looking really flat here. The other angle shows similar features with anterior synechiae closing the angle. The trabecular meshwork appears to be back here, and this is the canal of Schlemm here. What we have also is flat iris on this side as well, and there is some episcleritis out here. This is where the iris is adherent to the anterior lens. We've got the iris here. Notice how flat the front surface of the iris is. And there is an adhesion here between the iris and the lens capsule. The lens shows some globule and cleft formation here, which is consistent with cataract formation. The iris appears very acellular. This is because sometime in the past this has probably become infarcted. It's often very difficult to see new vessels on the front of the iris. The best clue is the ironing board iris, where it's really, really, really flat. In this view here, we can see two little vessels here and here. It's very, very subtle, and you may not be able to find neovascularization on the front of the iris, even if all the other signs of it being present are there. In the inferior angle, you might have noticed this little object. This is an adenoma of the non-pigmented epithelium of the ciliary body. They're incidental findings and have this classical lacy appearance. Moving posteriorly, we can see the cup in the disc. This has got several interesting features. The first is that there are some little tiny vessels, which we can see here, so neovascularization at the disc. This vessel here is probably normal because it's quite large. And then this tiny wispy vessel here will be a new vessel as well. The optic nerve usually has a waist here at the lamina cribrosa, but this one doesn't. It in fact is quite atrophic as it moves backwards. Here we have cystic atrophy of the optic nerve, and the meninges here are looking quite baggy. So there's a gap between the optic nerve and the meninges. This is the arachnoid here. On this side here, this is where the fovea and the macula are. And we're going to have a look at this in a bit more detail lately because there's some interesting changes on the macula as well. Here we have a close-up view of the retina. There's 1, 2 layers of nerve cells, but the ganglion cells that normally sit here are absent. The photoreceptors are actually looking in quite good condition compared to the photoreceptors, as we'll see shortly, in the macula. Here in the macula, something is very wrong. We've got large vessels and fibrosis here in the choroid, with some increased pigmentation, which is probably coming from the retinal pigment epithelium. In the RPE, we've got a drusen just here, and above that, we've got separation of the photoreceptors from the RPE. Now, this could be artifactual. We'll have to have a better look at the photoreceptors to make sure of that. we can still see that we've only got 2 layers of nuclei in the retina, and the ganglion cells, which should be along here, are absent. What this picture is of age-related macular degeneration plus glaucoma. In summary, what we have is an eye with long-standing glaucoma, as evidenced by the cupping and loss of ganglion cells. It's an angle closure glaucoma. We can see the flat irises, and we can see the anterior synechii here. In addition to that, the patient had age-related macular degeneration here, and an incidental finding of an adenoma of the non-pigmented epithelium of the ciliary body just here. The lens showed cataractous changes, and there was an adhesion here between the iris and the lens capsule, perhaps because of previous ischemia. The story of this eye is that the person had acute glaucoma, which wasn't able to be cured. And so this iris infarction could have happened in the phase of acute glaucoma, whereas all the other changes would have happened in the phase of chronic glaucoma.